Welcome to the Complete Arthritis Deep Dive. If you've watched our main arthritis breakthrough video, you're ready for comprehensive information covering every aspect of arthritis from causes to complete recovery. We'll explore 10 detailed areas with the latest medical research and practical guidance for lasting wellness. Progression and health. Impact without treatment. Arthritis typically follows a progressive pattern that can significantly impact overall health and quality of life. Initially, symptoms may be mild joint stiffness and occasional pain, but they often expand to affect multiple body systems over time. The condition can evolve from localized joint discomfort to systemic inflammation that permeates cardiovascular, respiratory, and neurological systems. The systemic health impact extends far beyond joint symptoms, as arthritis triggers chronic inflammatory activation throughout the body. This sustained inflammatory response can contribute to accelerated atherosclerosis, increased cardiovascular disease risk, and metabolic dysfunction. Arthritis increases the risk for heart disease by 50 to 70%, as well as the risk of stroke, kidney disease, and premature death, making early intervention crucial for preventing these complications. However, understanding progression also reveals hope for intervention at any stage. Even long-standing arthritis responds well to treatment, and the body's healing mechanisms allow for significant improvement, regardless of how long symptoms have persisted. Modern treatments can interrupt the progression and often reverse many of the negative impacts, restoring normal functioning and well-being within 6 to 12 months of beginning appropriate care. Underlying causes and risk factors. Arthritis results from a complex interplay of genetic, environmental, and lifestyle factors, with no single cause responsible for development. Genetic predisposition plays a significant role, with family history of arthritis increasing risk by 2 to 3 times. But having risk factors does not guarantee developing the condition. Autoimmune dysfunction differences, particularly involving HLA genetic markers, contribute to increased arthritis sensitivity. Environmental factors include smoking, which doubles rheumatoid arthritis risk, occupational exposures to silica dust and other toxins, and infectious triggers including Epstein-Barr virus and other pathogens. People who have experienced significant physical trauma or repetitive joint stress are more likely to develop arthritis. However, many people with these risk factors never develop arthritis, while others with fewer risk factors do, emphasizing the individual nature of the condition. Lifestyle factors encompass diet high in processed foods and inflammatory compounds, sedentary lifestyle leading to joint weakness, obesity creating mechanical stress on joints, and chronic stress elevating inflammatory hormones. Physical health conditions, hormonal changes particularly in women, and certain medications can also trigger or worsen arthritis symptoms. Understanding these multifaceted causes helps eliminate self-blame and emphasizes that arthritis is a legitimate medical condition requiring professional treatment. Diagnosis and assessment. Professional diagnosis involves a comprehensive evaluation that considers symptoms, medical history, and functional impairment in daily life. Rheumatologists and other specialists use standardized diagnostic criteria and assessment tools to ensure accurate identification and rule out other conditions with similar symptoms. The process typically includes detailed clinical interviews about symptom patterns, duration, and impact on work, family, and recreational activities. Physical examinations and sometimes laboratory tests help rule out medical conditions that can mimic arthritis symptoms, such as fibromyalgia, lupus, or metabolic bone disease. Many people feel relieved during the diagnostic process because it validates their experiences and provides a clear path forward for treatment. Healthcare providers emphasize the collaborative nature of diagnosis, encouraging patients to openly discuss all symptoms without fear of judgment. The diagnostic process also identifies any co-occurring conditions like depression, anxiety, or cardiovascular disease, which affects treatment planning and approach. Modern diagnostic frameworks recognize the complexity of arthritis presentations and focus on functional impairment rather than symptom severity alone. This comprehensive approach ensures that treatment addresses all aspects of the condition and maximizes the likelihood of successful recovery. Questions to get the best treatment and outcome. Engaging actively with healthcare providers through thoughtful questions ensures optimal treatment outcomes and builds collaborative therapeutic relationships. Essential questions include asking about different treatment options available, expected timelines for improvement, and specific criteria for measuring progress. Inquire about combination treatments, such as biologics plus traditional DMARDs, and whether newer treatments like JK inhibitors might be appropriate for your specific situation. Discuss potential side effects of recommended treatments, strategies for managing them, and what to do if initial treatments don't provide sufficient relief. Ask about lifestyle modifications that can enhance treatment effectiveness, including exercise programs, dietary changes, and stress management techniques. Understanding the provider's experience with your specific type of arthritis and their approach to treatment planning helps build confidence in the therapeutic process. Important questions also include discussing warning signs that would require immediate medical attention, how to access care between appointments, and involving family members or support persons in treatment. Ask about long-term prognosis, strategies for preventing relapse, and transitioning from active treatment to maintenance care. Request specific success rate percentages for recommended treatments and ask about clinical trials if standard treatments aren't effective. Medications and their effects. Modern arthritis medications offer effective symptom relief with improved safety profiles compared to earlier treatments. Disease-modifying anti-rheumatic drugs like methotrexate remain primary treatments, typically requiring 12 to 16 weeks for full effectiveness, while producing fewer side effects than older medications. These medications work by suppressing overactive immune responses to reduce joint inflammation and prevent progressive damage. Newer medications show promise for enhanced outcomes with faster onset. Biologic DMARDs, including TNF inhibitors, induce 60 to 80% response rates and are more rapid in onset, avoiding the delayed response that previously deterred many patients from medical treatment. JAK inhibitors may be prescribed for rapid symptom control, while longer-term treatments take effect, though these require careful monitoring to prevent cardiovascular and infection risks. Medication effectiveness varies significantly between individuals, often requiring adjustments in dosage or switching between different options to find optimal results. Most people experience substantial improvement within 3 to 6 months of starting appropriate medication. Side effects, when they occur, are typically mild and temporary, including nausea, fatigue, and increased infection risk that resolve as the body adjusts to treatment or with supportive measures. Holistic and complementary approaches. Integrative treatment approaches, combining conventional medicine with evidence-based complementary therapies, show enhanced effectiveness for arthritis recovery. Recent studies prove that regular exercise can reduce arthritis symptoms by 30 to 50%. Regular physical activity, particularly low-impact exercise including swimming and walking, produces powerful anti-inflammatory effects by reducing inflammatory cytokines and improving joint mobility. Acupuncture and traditional Chinese medicine provide practical tools for managing pain and inflammation while building long-term resilience. Yoga shows significant benefits for some people, particularly when combined with conventional treatments. Dietary modifications, including Mediterranean diet adoption and omega-3 fatty acid supplementation, support overall inflammatory reduction and may enhance treatment effectiveness. Mind-body approaches have proven incredibly effective in providing stress reduction and pain management benefits that people often need for comprehensive healing. These approaches recognize that healing encompasses the whole person, not just symptom reduction. The combination of traditional and complementary treatments often produces better outcomes than either approach alone, offering multiple pathways to recovery and long-term wellness. OTC items that can be of help. Several over-the-counter supplements and products can provide supportive benefits for arthritis management when used alongside professional treatment. Omega-3 fatty acid supplements help reduce inflammatory markers, particularly beneficial for people experiencing joint stiffness and pain. Glucosamine and chondroitin sulfate support cartilage health and may reduce joint space narrowing associated with arthritis progression. Turmeric and curcumin supplements show promise for anti-inflammatory effects through natural COX-2 inhibition. Research suggests that vitamin D compounds play a direct role in immune system regulation, supporting the use of vitamin D supplementation in arthritis management. Topical capsaicin and menthol preparations have analgesic effects for some people, though these should be discussed with healthcare providers to avoid interactions with prescription medications. Hot and cold therapy products can provide immediate pain relief during arthritis flares. These supportive measures work best as part of comprehensive treatment plans rather than standalone solutions. Self-help strategies. Empowering self-help strategies provide immediate tools for managing arthritis while building long-term resilience and recovery skills. Heat and cold therapy techniques quickly reduce pain and inflammation and can be used anywhere symptoms arise. Gentle stretching and range of motion exercises help identify and maintain joint flexibility that often becomes limited with arthritis progression. Stress management techniques include deep breathing exercises and progressive muscle relaxation that bring immediate symptom relief. Creating structured daily routines provides stability and predictability that reduces symptom unpredictability and stress. Regular sleep hygiene and fatigue management support overall immune system regulation and healing capacity. Gradual activity pacing helps overcome boom-bust cycles that maintain arthritis symptoms and prevent overexertion. Keeping symptom journals helps identify triggers and successful coping strategies for future reference. Building social connections and maintaining meaningful activities prevent isolation and depression while providing natural mood enhancement and stress relief. These strategies complement professional treatment and provide sustainable tools for long-term arthritis management. Supporting loved ones. Supporting someone with arthritis requires understanding, patience, and knowledge about effective approaches that truly help, rather than inadvertently increasing their burden or stress. Listen without judgment, and avoid minimizing their pain or suggesting quick fixes, as this diminishes their experience and can increase frustration and isolation. Instead, acknowledge their daily challenges and ask how you can best provide support during difficult periods and flare-ups. Learn about their specific triggers and limitations, and respect their need for accommodations while encouraging gradual progress rather than pushing too hard or expecting immediate improvement. Offer practical support like help with household tasks, transportation to medical appointments, or meal preparation during flares. Encourage professional treatment while avoiding becoming their primary medical advisor or trying to diagnose their condition yourself. Maintain your own well-being and set healthy boundaries to prevent caregiver burnout and resentment. Support groups for family members and friends of people with arthritis provide valuable resources and connection with others in similar situations. Celebrate small victories and progress, understanding that recovery is often gradual with ups and downs rather than linear improvement. Prevention strategies. Building resilience and implementing prevention strategies can significantly reduce arthritis risk and prevent symptom recurrence in people with previous episodes. Regular exercise and weight management create a foundation for joint health and inflammatory control throughout life. Developing healthy stress management skills early helps people navigate life challenges without triggering inflammatory flare-ups. Maintaining anti-inflammatory nutrition patterns provides natural buffers against inflammatory triggers that can precipitate arthritis development. Learning to identify and address early warning signs before they become entrenched prevents the development of chronic inflammatory cycles and progressive joint damage. Regular medical checkups and monitoring help detect problems early when intervention is most effective. Early intervention during adolescence and young adulthood, when many arthritis types often begin, can prevent progression to more severe conditions. Education about arthritis risk factors helps people recognize early warning signs and seek help promptly. Building strong social support networks enhances stress resilience and reduces inflammatory burden throughout life. These prevention strategies benefit everyone, regardless of arthritis family history, by promoting overall wellness and resilience against chronic inflammatory conditions. Subscribe now to join thousands getting reliable health information that improves lives, as knowledge is your best medicine, and we hope you've gained valuable insights from this video series. Make sure to subscribe and like this video. It helps us create even more valuable health tips for you and others. Don't forget to share with anyone who would find this useful. Also, please comment below with any questions or topics you'd like us to cover next. Stay informed, stay healthy,